Muscatine County in particular is in a mental health crisis.
Our clients don't come with us usually with just one issue. They have their families, their family units have a multitude of issues.
I'm very passionate about what I do.
I like to think that I make a difference in a child's life. I like to think that I can prevent the abuse.
We provide a safe place.
A safe place.
For women.
For children.
For families.
Domestic violence and rape, sexual assault is one of the most underreported crimes, both of them are. I think that in Muscatine County, because of all the work that we as a program have done with our collaborators with, the Muscatine County Sheriff's Office, the Muscatine Police Department, Department of Human Services, the schools, Department of Corrections, and the County Attorney's Office, all of those collaborations have instilled in the community and in the county of Muscatine that indeed, domestic violence and rape, sexual assault is taken very seriously when it's reported. And this is the kitchen. And this is, communal. The kitchen and the living room and dining room and that are all communal. I remember particularly, it's probably about, 7 years ago, we had, unfortunately, in Muscatine County, a string of murders. And in every single one of the situations, the woman had either just left the partner or had said she was leaving and ended up being murdered.
Verbal, mental, physical abuse towards me, a lot of verbal abuse towards my kids. Actually, it started off within the first month of it, but I stayed.
We have a program that helps them learn not just the risk factors for the environments that are conducive to domestic violence, but also how to get out of those. So just like once you're poor, it's hard to get unpoor. Once you've been in a domestically violent situation, for example, it's very, very difficult to get out of that.
I really like seeing the client and welcoming them from the day that they walk in the door, and knowing that whether they're here for 2 weeks or the 90 days, myself and the staff here have worked as hard as they possibly can to educate them, to make them feel safe and secure, to find resources for them, to work on their goals. And I really like to see the difference that it's made and how much further off they are when they leave than when they came in.
I'm a lot better now. I've came here, I've gotten a job, I've gotten my own vehicle. I'm like just a couple steps away from getting my own place. So I have very high hope.
All right, just one more story. Sounds like you guys want more story.
Yeah, because we like stories.
All right.
We just asked you if we could have one more story.
I would leave for work early in the morning, come home, and they'd still be in their bedroom. Sometimes they would be locked in their bedroom. He wouldn't check on them.
Just one more story? Austin always begged. You know the rules, cowboy, Dad said. Just one story at bedtime.
He was threatening our workers. He told me he had Googled their names and addresses. And, he was saying that if they showed up at the house again, he was going to get his shotgun out.
Austin fell asleep while Mom and Dad whispered softly nearby. One Texas night, they played Hank's Music Hall. They set the room to rocking and the cowboy boots to stomping.
So I agreed to have lunch with him, and we were seen at a restaurant by our DHS caseworker. And that's what prompted to have the boys removed. And that was the hardest. So that really really helped to just build my confidence and know that, I didn't have to be with someone who was going to treat me like that. February of 2010, I got him back. I've come a long way, and it's, a lot of it is due to the help I got from Family Resources.
The average amount of taxpayer dollars spent for mental health in Iowa counties is around $36. In Muscatine County, it's $3.33, 1/10. The National Health Administration has designated Muscatine County as an underserved county, which means we don't have enough mental health providers here. We have 42,000 people in our county. A recent survey from United Way Task Force found that 34% of Muscatine County residents suffer from anxiety and depression. And the number is almost 16,000 people. Well, I think we have a huge role, not only because we are one of the few providers here in Muscatine. We are the only provider that accepts a sliding scale fee. People who don't have insurance, who don't have money, this is the only place they can come to get mental health treatment. Well, I used to be a house painter. One thing I liked about being a house painter is I could take a house that looked awful, and within a matter of 2 to 3 weeks, create it into a thing of beauty. And in a similar manner, I get to see that happening here. I get to see the metamorphosis from someone who's suicidal, who calls the suicide crisis line 3 and 4 times a week, who's hospitalized repeatedly for trying to kill themselves and not succeeding, come in here. They're divorced, they don't have a job, they have no money, and turn their life around right before my very eyes.
I think many of us who do this work have been touched by it in some way in our lives.
I like seeing the families, getting to know the kids. I get great satisfaction from that because I know that we do make a difference.
It helps our community by helping create a safer community.
And it means that my kids don't have to be in fear. They don't have to worry about if I'm okay.
I could go on and on about Family Resources and just everything that that they've done. I mean, I don't think I could have done it without them.